Some questions on the test, okay? All right. It's important to listen empathetically and use a gentle tone of voice with family members of a dying person because A, research has found that these behaviors will encourage the family members to follow instructions. B, these behaviors will help the family cope with the situation. C, family members need to express their rage and anger, and these behaviors will make you a likely neutral target.
It's that one.
False reassurances and words of hope are the best way to get the job done as quickly and efficiently as possible.
I'm gonna go. It's obviously D, right?
Wait, that was an multiple choice.
Can I phone a friend?
Come on, seriously, guys.
Okay.
The faster we get through this.
B.
B?
The answer is B. These behaviors will help the family cope with the situation. All right. They all kind of sound right, don't they? Yeah.
No.
The primary responsibilities of a responder include reassuring a victim's friends or family. B, assisting more advanced personnel. C, keeping knowledge of emergency care up to date. And D, ensuring initial emergency care.
Wait, what was the question?
D.
The primary responsibilities of a first responder include.
All of the above.
Nice try.
D.
D, ensuring initial emergency care. All right, cool. That one is kind of a no-brainer.
Wait, posted the question?
There are, I think, 70 questions. I'm not going to go through all of them.
Wait, that's the actual test?
Yeah, this is the actual test.
There's 70 multiple choice questions.
You're not timed. Just take as long as you need.
Oh, so I shouldn't be recording
You
this?
need an 80 to pass, so you can get 14 of them wrong.
Oh, that's generous. What the hell?
When can a first responder stop care on a patient once care has begun? A, if the first responder determines the patient is dead. B, if a family member tells the first responder that the patient is dead. C, if the first responder is summoned to a more serious situation. Or D, when a person with higher equal, that one's a no-brainer.
What was the question?
Higher equal certification. When can a first responder stop patient care?
Oh, okay, yeah.
Ah. You have arrived at the scene of a vehicle collision where there are downed electrical wires. You should A, assume the wires are energized and move any crowd back from the danger zone. B, check if the wires are energized, and if not, go ahead and move them. C, tell the victims to try to remove themselves from the scene. Or D, use something non-conductive to move the wires so that you can reach the victims.
Oh yeah, that sounds smart. Definitely.
Good. Assume the wires are energized. All right. Okay. A first responder may have a strong emotional reaction to a specific situation that interferes with his or her ability to function. This condition is known as?
Empathy?
What are the choices?
A, emergency reaction. B, anxiety transmission. C, critical incident stress. Or D, normal response.
C.
C, critical incident stress. All right. What's the 4 components that must be necessary to bring lawsuit of negligence to the first responder? Does anyone remember this? No, that's not one. That's
What? Wait.
abandonment is a kind of breach of duty, but
What are the options?
Was it improper care?
Yeah, but do you know the order? All right, the answer is going to be duty, breach, cause, and damage. Okay, need all 4 to get a lawsuit. You need to have a duty. You need to breach the duty. There needs to be a cause. I don't know what that means, and damage needs to be done.
Wait, do you have to remember the order or
That
just
means
the
your
4?
breach actually caused them damage. Like it had an effect.
Right.
Yeah.
Okay. Oh, that's what caused me. That's right. Okay.
Yeah.
So do you have to
Cause
remember?
links breaching damage. Right.
We have to remember the order, or
I mean.
Okay,
The other choices are breach, consent, cause, and damage. Duty, battery, damage, and cause.
Okay.
Battery, abandonment, consent, duty. So just remember, duty, breach, cause, damage. Okay, that one we went through. That one should know. That one should know. It is important to document an exposure to communicable disease in order to A, warn others of potential exposure. B, receive appropriate follow-up care. C, perform appropriate disinfection procedures. Or D, start containment procedures from infection. Sorry? Follow-up care. I'm pretty sure. Yeah.
I know he's suddenly have no battery.
Okay, this one's a good one.
QQ.
Boy is struck in the head with a baseball bat. Responder fails to think that the child may have a back injury and walks the child home. That evening, boy loses sensation. Which of the following actions describes the actions of first responder? Abandonment, negligence, refusal of care, or appropriate care?
Negligence.
Negligence.
It's appropriate care.
Yeah, because you took care of him.
I mean,
Well, okay, so hang on.
just all the stuff.
Yeah, negligence. Or abandonment, hang on. Yeah, it's negligence.
And
It's
then-
negligence.
Yeah, he didn't. He never left him.
So he got hit in the back of the head with a baseball bat. He thinks it's fine and walks him home. Okay, and later that evening the boy loses sensation. Okay, that's negligence because you failed to assess correctly the situation. Abandonment would be you got up and left. Okay, that's the difference.
Yeah, just call this. I don't know, when was that?
Unlawfully touching a victim without a victim's consent is?
Battery.
Thank you. How often should you
Energizer.
recheck a patient's condition? Critical patient.
5 seconds.
Huh? 5 minutes. What structure prevents food from entering your lungs while you swallow? Epiglottis.
Very good.
Which of the following organs are considered vital organs? Anyone want to take a guess? Heart, brain,
Brain. Lungs.
lungs. Okay, good.
Most of your intestines.
What's the master organ?
Brain.
Brain, good. Okay, patient experiencing pain, discomfort, difficulty breathing, what position should they assume? Rest on their left side, sitting straight and upright, position of comfort, lying on back.
Whatever they want.
What are the symptoms?
Experiencing pain, discomfort, or difficulty breathing.
Do they have C-spine?
Comfortable.
There you go, position of comfort. Okay, this is from today. Truck accident. You notice a clear liquid leaking from the rear compartment.
Light it on fire and run away.
Light it on fire.
Guys, go find Irma.
Oh.
Windpipe is also known as the
Trachea.
Okay, this is also from today. You called to a scene for an airplane crash. First victim you approach has a broken leg, is conscious and breathing. In the START system, the person should be classified as?
Yellow.
Well,
He can't walk.
oh, wait, is one person live or 2 persons?
Immediate care, delayed care, walking wounded, or unsalvageable. Unsalvageable.
Delayed care.
Actually, it's unsalvageable. No, I'm just kidding. It's delayed care.
Pretty harsh conditions right there.
He said is conscious and breathing. So when they say conscious, they mean yeah. Hang on. Oh, first common sign of shock in a person is A, restlessness and irritability, dry, normal colored skin, cool, pale skin, rapid pulse and breathing.
E? E?
Yeah, restlessness and irritability. It's pretty subtle, but first sign of shock, like this is really, really early, is restlessness and irritability. Cold, pale skin and rapid pulse and breathing, they come later on, okay? Proper care for a closed wound, okay, never mind, you guys should know this. What do you do with an avulsion?
Oh, wet.
Avulsion?
Avulsion.
Wrap loose?
Completely avulsed earlobe. It's off. It's not hanging on.
Oh, then you put.
Oh,
And then put the bag. Ice, good.
that's an amputation, isn't it?
Yeah.
Yeah, that's not an avulsion. That's avulsion is something else.
Oh, okay. So you have an embedded object. You should control severe bleeding by
Log cabin.
embedded object control bleeding by.
Log cabin.
Not
No,
log cabin. Log
don't-
cabin doesn't.
Oh,
Don't pull it
putting
out.
Pressure around the log cabin.
Okay. When do you take out a embedded
If
object?
it compromises C-spine or
Or you can
if it compromises
If it compromises
airway or
ABCs.
circulation.
Okay. What is this? What is severe bleeding compromise?
See.
C. So what should you do?
Take
Take
out
it
the
out.
object. And then apply
Never
pressure.
mind. I'm wrong.
No, you
My
don't
bad.
take it out.
Bandaging dressings around the object was right.
Oh.
Yeah.
It is screwed.
My bad. No, that's not. Yeah, it's indeed 80, right?
You're allowed to get 14 wrong.
Out of how
70.
If you fail the first time, you can take the other version of the test. If you fail again, we have to give you a verbal test. If you fail again, we'll give you another verbal test. you're not gonna fail the test.
You have to try to fail that test.
I'm gonna try.
Why do you apply ice to a bite or a sting?
You don't?
No, you didn't.
Swelling and pain relief.
Oh.
You ice to relieve swelling and for pain relief. Okay.
Okay. No.
What bite don't you put ice on?
Oh, the core area?
No, snake bite.
Oh, the snake. Because it does something to your vessels. Constricts your blood vessels.
Because snake venom usually goes to the lymphatic system, and so if you cool the area, the cooled blood will go faster to your vessels. That's circulating your blood.
I just wanna dance.
It doesn't attack it as fiercely as the snake
I don't really care. Hi guys.
A victim suffering from progressive heat-related illness may not be sweating. A victim's inability to sweat can result in the more serious condition of heat exhaustion, ineffective body cooling, and rapidly rising body temperature leading to heat stroke, low levels of bodily fluids causing tremors or convulsions, or heart and kidney failure as a result of fluid retention. B, heat stroke. Good. All right. What are the following factors will help you determine whether or not you'll have to assist with delivery? A, whether or not the woman has had a recent illness. B, the number of months or weeks the woman has been pregnant. C, the length of time the woman's last baby was born. Or D, whether or not the baby's head is visible. When would you help with the delivery? D.
D.
Close the door.